Hello, I'm Dr. Steve Hotze. Welcome to Health and Wellness Solutions. Another aspect of treating hypothyroidism is getting the correct dosage of thyroid hormones in the patient. You might be wondering, how do we know how much thyroid hormone to give a patient? With me today is Dr. David Sheridan and Dr. Don Ellsworth to discuss this very subject. Well, how do we know how much thyroid hormone to give a patient? What kind of thyroid hormones do you give, and how do you know when to change the dose?
We treat using natural desiccated thyroid hormone. It works very, very well. And we adjust our dose, I guess, the old-fashioned way. Is the patient better or are they not? So we slowly titrate the dose of thyroid hormone up every 2 to 4 weeks, watching symptoms get better till symptoms are resolved, always watching a free thyroid hormone level, a free T4 level, ensuring that it stays in the normal range.
And the reason you want to do that is, since you're not treating based upon the blood test, explain again, why do you get the blood test then?
It's a safety check. We basically want to make sure that we're keeping the level of thyroid hormone within the range normally in the body. And of course, we never want to see any signs of too much stimulation. But what we don't want to do is focus in on the TSH level as the main guide, because again, that regulatory hormone does not serve us well either in diagnosing hypothyroidism, at least most of the time, and it doesn't serve well in dosing most of the time.
So, in the evaluation and diagnosis of hypothyroidism, we basically use clinical history, physical signs, and body temperature. And in evaluating the results of treatment, we follow those same parameters. We look at their clinical history and if their symptoms are resolving or not, whether or not they're obtaining any change in their physical signs, and if their body temperature is rising.
Dr. Ellsworth brought up a great point about not being a slave to the TSH, because this regulatory system can indeed malfunction. And as you're treating patients and arriving at their dose of natural desiccated thyroid, getting their symptoms resolved, the TSH may actually go low. And this is a reflection of a malfunctioning regulator. This is called central hypothyroidism.
Hypothyroidism is a most common problem, overlooked and unrecognized by most conventional physicians. At the Hotze Health and Wellness Center, we've treated over 15,000 patients who clinically had the signs and symptoms and low body temperature, which were indicative that they had hypothyroidism. We treated them and have treated them and do continue to treat them with desiccated thyroid hormones, and we have had great results. Thank you both, Dr. Sheridan and Dr. Ellsworth, for joining us today. At the Hotze Health and Wellness Center, we specialize in treating patients with hypothyroidism. We'd love to answer your questions that you might have in regards to the treatment of hypothyroidism or other conditions. If you have any questions regarding your health, please feel free to email us at drhotze@drhotze.com or call to have a free consultation with one of our wellness consultants. Phone number is 877-698-8698. That's 877-698-8698. Also, be sure to join our email list. And once a week, we'll send you a video highlighting various topics regarding women's health, hypothyroidism, natural hormone replacement, and numerous other videos which will be pertinent to your health. We're excited to help you get on a path of health and wellness so you enjoy a better quality of life. This is Dr. Hotze saying thanks so much for joining us today.